So I think another good rule of thumb is to keep trying new foods over and over, and that way your kids are more likely to get used to the food and incorporate it as in their diet. There's actually a study done, and it looked at how many times it took for I think it was a toddler group of kids, how many times it took them to try a new food before they would incorporate it into their diet. Do any of you know how many times it takes? Shout it out. 30. Not quite that many. But yes. About 10 to 15 tries of a new food before a child will incorporate that food into their diet. So until you've tried something at least that many times, you don't want to give up on it. It's also not a good idea to coerce or bribe or belittle or punish your child into getting them to try the new foods. You want to have a relaxed environment and just encourage them to try the new foods. Also, if you tend to be a picky eater yourself, it's more likely that your kids are going to be picky eaters. There are studies that confirm that as well. So the more varied your diet is, the more likely that your child's diet will be varied as well. Be realistic about serving sizes and numbers of foods that you incorporate. So for a standard snack, I would expect 2 food groups to be offered. And for a standard lunch, maybe 3 or 4 food groups. I like the little plates by IKEA and these little snack size containers, because if you overwhelm your child by putting too much food on their plate, they're really going to be disinterested in eating. So the smaller plate sizes and the small containers that you can put in their lunch are really a good idea, because kids don't, especially the ages between 3 and 5, they're not going to eat as much as an adult would. They're going to eat about 1 tablespoon of each food that you offer per age. So a 3-year-old would only eat about 3 tablespoons of each food that they are offered at a meal. And that's about all their stomachs can hold. And that's why the younger kids tend to eat more frequently throughout the day. It's expected that they would have breakfast, snacks, lunch, snack, and dinner, and even maybe a snack after dinner. So kids that are younger in that toddler range need to eat small amounts more frequently. It has to do with physiology and the size of their stomach. Parents are not short order cooks, okay? And that is my golden rule in my house. I'm just too busy to make separate meals for all of my kids. So what we serve for dinner is what I expect that they will or will not eat. And it's not up to me to decide if they will eat or how much they eat. That's up to them. But what my job as a parent is to set the meal times, to provide a wide variety of healthy foods, and expect that they show up for meals. The rest is really up to them, whether they're hungry, how much they choose to eat, and what foods out of what I serve they choose to eat. So if you kind of follow those rules and sort of lay low, it takes a lot of pressure off of kids, and you can also just encourage them to try new foods and give them positive feedback. The other thing that can help with small appetites is to limit juice and milk in between meals and really stick to a nice schedule around meal time. So having a regularly set breakfast time, snack, lunch, snack, dinner schedule, and avoid a lot of excess juice and milk in between meals, that really helps them to come to the next meal ready to eat and with an appetite. Because the juice and the milk can really fill those little tummies up, and then they're not ready to eat more nutritious, varied foods. I think that's about it for picky eating. And another thing about lunches being sent home is I found that in my own child's diet, peer pressure was a very powerful and nice thing, because kids do really well in social environments when it comes to eating. And sometimes my own kids won't try things when I serve them, but when their friends are eating them, boy, that really, gives them another angle. It's like, oh, well, Kyle likes it. It must be pretty good. And then they're more apt to try it. And I've had my kids come home and say, Mom, I'm really tired of that, turkey sandwich you keep sending me, but my friend Carly gets these turkey roll-ups with, cheese inside, and that looks pretty appetizing. So they give me really good ideas of things to try for them, things that they've seen their friends eat. So that's always a nice thing to kind of keep in mind as well. I think that's all I had for a presentation today. Are we going to wait for questions at the end?
We can go for it. I mean, people
Okay.
probably have questions now. So
All right. Yes.
I'm trying to figure out if I'm supposed to be a leader. I have a 14-year-old, okay, and I found out about this through my daughter's high school.
Uh-huh.
And so when you're talking about tiny tummies, it doesn't even relate to...
Yeah, it's a total opposite thing, right?
So I've been through, you've been talking about when she was younger than a toddler. So I'm just wondering, is this focus...
You can ask any questions about any kids and nutrition you want.
And for the evening, is this focused on really young kids?
I don't think so.
the entire scope.
Do you have tips? I know you said, don't pay a short order cook. My daughter's a vegetarian for several years now.
Yeah.
And so I have the nutrition needs for a vegetarian who is being vegetarian, and my husband and I may not be being vegetarian.
Right.
Those issues, and you mentioned calcium requirements up to 8, but at age 15, I know it's got to be different.
Yes, yes, it's higher. And I think it's close to 1,000 or 1,200 milligrams for older kids. So you wanted me to comment on the older kids and just healthy eating in general?
I don't know if it only applies to me.
Okay. I think the biggest challenge for older kids in the teen years is schedules, because everybody is on different schedules, and there's a lot of sports activities, and it's often time to it's hard to come together as a family to eat. But I think there is some benefit in that still, to try and make some dates to sort of eat as a family. And the same principles do apply in terms of, you can't cook different meals for everyone. Certainly if your daughter has vegetarian practices, many of the standard meals can be adjusted somewhat to accommodate a vegetarian, with the side dishes that may have, for example, rice or beans or cheese, things that she can eat, and just skip the main meat portion if that's what you serve in your house. Or, pick a few nights a week where you kind of focus on the vegetarian, likes of your daughter. That would be another way to handle that. Yes?
I'm in the same place. For a child beginning high school, an anxious, overeating adult female who really cannot stop eating now since school started, and like in 2 weeks gained 7 pounds. So some suggestions for lunch and other ways to deal with the fact that she can't stop eating.
Prior to this, there wasn't really a weight issue, it just sort of happened during...
Began a year ago, but she had worked all summer on getting her back in shape, and 2 weeks of school, it's just totally out the door.
Right. Okay, so for lunch suggestions, I think the schools are doing a little bit better in terms of providing healthful meals, at least
We provide the meals.
so you do. You send it home with her, right? So the same things apply. I mean, she may be involved in packing her own lunch at her age, and that's completely reasonable. And just encouraging, because you're still the parent and in charge of the food inventory of the house, so encouraging healthful, varied diet by having lots of fruits and vegetables available. And then in terms of the overeating, I think it's a little bit of a challenge trying to identify what factors may be contributing to that, and talking to her about her anxieties and maybe some other things that she can get involved in to help with the overeating. Some activities, she's anxious about meeting friends, trying to have a forum where she can meet some new friends, but that's a little bit beyond my scope and not really my area of expertise. But I would think that maybe some outside help to help her identify what issues she's got going on, because there's so much non-nutrition related when it comes to that type of behavior, where you have to deal with the feelings and the anxieties that go along with it. Any other questions? Yes?